Well, hello. I'm a medical practitioner with a special interest in tobacco treatment, tobacco control and tobacco harm reduction. I'm on the committee that develops the Australian National Smoking Cessation Guidelines, and I'm the founding chairman of the Australian Tobacco Harm Reduction Association, which is a registered health promotion charity dedicated to raising awareness of vaping and other safer alternatives to smoking. I'm past vice president of the Australian Association of Smoking Cessation Professionals. I was a conjoint associate professor in the School of Public Health and Community Medicine at the University of New South Wales in Sydney until 2020. I'm actively involved in helping smokers quit, in teaching, writing, research, and advocacy on smoking. I've been involved in many research studies on smoking treatments, and I'm currently an investigator on a large vaping trial funded by the Australian government. Well, vaping is unique in that it addresses the two main causes of cigarette dependence. Firstly, it delivers nicotine effectively, and that's what smokers are addicted to. Secondly, it replicates the hand-to-mouth habit and the sensations of smoking, which smokers often miss after they quit. And people can continue to vape to prevent relapse to smoking, which is a big problem for people who quit. We're increasingly confident that vaping is an effective quitting method because it works in a range of different settings. Firstly, it works in randomized controlled trials, which have shown that vaping is 50 to 100% more effective than nicotine replacement therapy. Secondly, in large population studies in the UK, in the US, and in Australia, smokers who use vaping have higher quit rates than those that don't. And when people vape daily, they're 3 to 8 times more likely to quit than smokers who didn't vape. And this is in the real world studies. Thirdly, the decline in smoking rates is accelerated in countries where vaping is widely available. For example, the smoking rate has fallen 3 times faster in the UK compared to Australia since 2013, when vaping became available there. Fourthly, observational or cohort studies of smokers in the real world, the better quality studies have found that vaping is effective. And finally, there are over 82 million vapers globally, and their testimonials are very compelling. In comparison to other smoking treatments, a recent study of 171 randomized controlled trials, which was analysed by the UK National Institute for Health Research, concluded that vaping was the most effective single quitting agent, followed by varenicline and NRT. Conventional treatments of smoking unfortunately have very low success rates and don't work for most people. So even in clinical trials with first-line medications and support, 92% of subjects are still smoking after 12 months. And up to 2 in 3 of these continuing smokers will die prematurely from their smoking. And this is where vaping is most useful. It's a quitting strategy for those people who just can't quit with other methods and who will otherwise continue to smoke. And we know that switching to vaping dramatically reduces their risks. It's at least 95% less harmful than smoking, according to some well-respected bodies like the Royal College of Physicians in the UK. Some of those will go on to stop vaping. Others will continue to vape to prevent relapsing to smoking. We know from many studies that switching to vaping leads to a dramatic reduction in exposure to toxins, reduced biomarkers, which are the toxins in the body. There are substantial health improvements, such as improved asthma, blood pressure, emphysema, and huge financial savings. But I think the most important message is the public health impact of vaping. And vaping has huge potential to improve public health. The effect on public health depends on how effective an intervention is and its reach, or how popular it is, the number of people who use it. Well, vaping is the most popular quitting aid in the world and the most effective. And so as a result, it has the potential to reduce smoking rates more than any other intervention. And almost all the costs of vaping are paid by the user with minimal government expense. And a growing vape industry provides employment, taxes, and other benefits. Well, vaping is very different to smoking and a much lower risk product. And so regulation should be proportionate to the risk of the product, and it should allow adults access, adult smokers, while restricting adults access to young people. So the key in regulation is to find a balance between making vaping products readily available, attractive, effective, and affordable for adult smokers to help them quit, while minimizing access to young people, just like any other consumer product like alcohol and cigarettes. The other very important principle is that regulation should be risk proportionate, so that more dangerous products are more strictly controlled. Now, vaping's around 95% safer, and it should be easier to access than deadly cigarettes. So some of the principles that are used and are recommended for vaping along those principles I mentioned are that vaping products should be sold anywhere where strict age verification is available. And that includes places like tobacconists, vape shops, pharmacies, and general stores. The vendors should be licensed, and any sale to underage users should result in harsh penalties and loss of license. Thirdly, regulations require quality and safety standards, which should be introduced nationally. Fourthly, advertising should be restricted and focused on adults switching, and that's their purpose, to get people to switch from smoking to the much safer vaping. Fifthly, products should not be appealing to young people. They shouldn't be presented in bright colors and with funny names that appeal to young people. Sixthly, taxes on vaping products should be kept as low as possible, so that there's a financial incentive for smokers to switch. The Royal College of Physicians suggests the tax should be about 5% of the tobacco tax, which is proportionate to the risks, the relative risk of the products. Flavors shouldn't be restricted, as they are important in encouraging adults to take up the much safer alternative. And public messaging should frame vaping as an adult smoking cessation tool. That's what it's for. It's not for children, not for young people. It's to help adults quit. There also need to be regulations on where people can and can't vape, and there should be some restrictions on indoor vaping, but restrictions outside are not justified on health grounds, because secondhand vapor so far hasn't been shown to have any significant health risks. And there should be comprehensive regulation to using those strategies, which will greatly reduce the black market, which is otherwise a big problem without regulation. New Zealand and the UK have regulations based on these principles, and they're working well. Look, I strongly support the Smokefree Generation proposal. Preventing uptake of smoking by young people is an important part of reaching the tobacco endgame. But the smoke-free generation has not yet been implemented in any country, although New Zealand has committed to introducing it in 2022. The plan has the benefit of not denying currently addicted smokers access to smoking. So that would be a concern with a ban on smoking in adults. Introducing this policy involves retailer compliance and strict enforcement. tobacco retailers will be reluctant to lose revenue, and they need to be supported and educated. But as the change is gradually introduced year by year, it is a gradual process, and it allows time for restructuring and alternative products, replacement of profits with other services. This plan has very strong support where surveys have been done, such as in the Australian state of Tasmania and in Singapore, and it's supported by adults and adolescents in those studies. So it's likely to be well accepted by the public. And it will be a very low cost intervention for the public, so that it involves very little expenditure by the government. There will be some resistance on the grounds of loss of personal freedom and lost tax revenue, but it's the right thing to do, and it will save lives, it will protect children, it will reduce healthcare costs, and they should take priority over profits. If this option isn't implemented, an alternative proposal is to raise the minimum age of cigarette sale to age 21. This has been successful in reducing smoking initiation in 18 to 20-year-olds in the United States, where it came in December 2019. That program also requires enforcement, compliance checks, and penalties for retailers, but it does have strong support in the public, by the public in many countries. There will be retailer objections and reduced tax revenues, but again, the priority should be to save lives. I think that the smoke-free generation needs to be combined with vaping. So the smoke-free generation proposal minimises uptake of smoking by young people, but it doesn't help the established smokers, the millions of people who are currently addicted, who can't quit, and many of whom will go on to die from smoking, and for whom other quit treatments just aren't working. So to reduce rates throughout the population as quickly as possible, we need to help adult smokers access regulated vaping products. And this will lead to the maximum rate of reduction in current smoking if it's supported and encouraged by the government, as vaping is in the UK and the US. And again, vaping involves minimal cost to government as well, because the users pay for the cost. Australia has successfully reduced smoking rates over the last few decades with a comprehensive range of tobacco control policies. The three most effective policies have been cigarette price rises by increasing cigarette taxes, mass media advertising campaigns, and smoke-free policies. And they are thought to have accounted for about 75% of the reduction in smoking rates. But over the last few years, the smoking rate has declined, and compared to other countries that have vaping, and we think that Australia needs to take that next step. But looking at what we've done, increasing taxes has been the single most effective strategy, particularly for young people, particularly for lower SES populations who smoke most heavily. The World Health Organization recommends excise levels to 70% of the total retail price. And ideally, some of that taxation would be used to support tobacco control and help people quit, and with other health promotion activities. There is a point, though, where tobacco taxes get too high, and Australia has reached that point now where the high taxes are leading to smuggling, a black market, and financial stress for addicted smokers. But I think Malaysia still has a long way to go before that, and some of that revenue, of course, can be used for other purposes. The second most effective quitting method is social marketing or mass media campaigns. They reach large numbers of people, discourage young people to take up smoking, and they trigger quit attempts. But they are expensive, involve a lot of funding, and they need a lot of repetition. And they can be targeted at specific at-risk groups. They are effective, but they are expensive. Smoke-free legislation has also been found to be very effective. That's bans in public places, indoor bans, workplace bans, banning smoking in cars with children. And this means people have fewer opportunities to smoke, and it helps to denormalize smoking. So people don't see smoking around as much and it becomes less fashionable. Other strategies that are important that have worked in Australia are complete advertising bans and graphic warnings and plain packaging. They reduce uptake and they reduce the appeal of smoking for adults. But in Australia, our smoking rates have leveled out over the last few years. And in spite of all these measures, we need to take further steps. And we think that, and the research shows that the harsh restrictions we have on vaping are very much slowing down the decline in smoking in Australia. In other Western countries where vaping is freely available, smoking rates are declining much faster. And Australia needs to make vaping more accessible for adult smokers to help them quit and to kickstart the decline once again in smoking.